30 years ago, on April 21st, 1990, protesters from the AIDS Coalition, ACT UP, stormed the gates of the National Institute of Health. They were upset by bureaucratic delays holding back research into AIDS treatments, and so protesters carried with them fake coffins, and they set up hundreds of cardboard gravestones symbolizing all who had died to AIDS, and they even took a mask and they put it on a pike and they paraded it around with the name of the health official that they believed was responsible for all the delays. Anthony Fauci. There were several reasons why ACT UP was angry. Dr. Fauci's department did not start drug trials for AIDS treatments until June 1986, 5 years after the epidemic started, and progress had been slow. Also, desperate patients were given access to only one experimental treatment if they were given one at all, which meant that many died without exploring their available options. And Fauci recalls that moment as the moment when things clicked for him, when he finally understood. And he said to himself in that office, watching those protesters outside, if I was in their position, if I was as desperate as they are, I would ram down the doors too. And so he started to have more conversations with AIDS activists, and they set up a program called the Parallel Tract. And that program allows far more people access to new compounds before FDA approval happens. And so today, if you get treated for COVID-19 or if you use an experimental drug, it happens through the FDA's Parallel Tract, something that only happened because ACT UP stormed the gates of the NIH while the rest of the nation was barely paying attention. And I'm beginning to hear more and more stories like this over the past couple of weeks. And I'm beginning to realize that the systems that we rely on to survive in this moment, the systems that are protecting us from this pandemic, those systems were not built in response to the flu pandemic of 1918 or because of forward-thinking elected officials. They were built in direct response to the AIDS epidemic, the AIDS pandemic. The 1980s. For example, our shelter-in-place order. Our shelter-in-place order was the result of a consortium of local public health officials in these 6 Bay Area counties. They rely on the support of each other to make unpopular decisions. We all make this decision together. And without the association of Bay Area health officials, shelter in place and stay at home and all the other social distancing orders that followed, they all would have been delayed. Everyone afraid to take the first step, and the death toll from this pandemic would have been exponentially worse in our area. But where did that association come from? In the early 1980s. The San Francisco Department of Public Health did almost nothing to inform the public about the dangers of HIV/AIDS. Who was it that stepped up? Who was it that did the work? It was the Harvey Milk Gay Democratic Club. It was the SF AIDS Foundation who started their own information campaigns. And it was because of their advocacy work that in 1985, the San Francisco health director finally sat down with other county health officials to treat the AIDS epidemic as a public health crisis and not as the gay disease that they had treated it as in the past. Those systems were built by those LGBT protesters and pioneers in the 1980s. And those systems are saving our lives today. It was true then, and it is true now. We are one body. If one of us suffers, all of us suffer. If one of us rejoices, all of us rejoice together. That is the foundational principle of public health, and it is a foundational principle of our faith. And it works that way because Paul got it from public health officials in his day. And so today, 30 years later, I give thanks to those protesters who refused to suffer in silence, for those people who demanded that we treat an epidemic like an epidemic. We're safer because of the work they did. But I'm also thinking about the future because we have this opportunity right now to build the systems that will protect the future. We're determining right now how the future will respond to crises like this when they come about. We have this moment, this opportunity to wake people up to the dangers of the climate crisis that scientists have been warning about and the public hasn't been listening. It's right around the corner. We have the chance to shape the future right now. Are we going to be like ACT UP? Are we willing to storm the gates of the NIH and demand change that protects everyone? Or do we still believe that your health isn't my problem? God help us. Stay healthy, St. Andrew.